More than 1 in 5 Americans are caregivers, providing care to an adult or child with special needs. A growing number of these caregivers are family members and companions, in need of resources to help them provide the best care to their loved ones. AARP Public Policy Institute and Centene Corporation recently convened a series of conversations with caregivers, their care recipients, and providers for Mary Center, a senior wellness center in Washington, D.C. These conversations focused on the financial and emotional strains that caregivers face, as well as the barriers they encounter when trying to access resources.
You know, when it comes to caregiving, I think all of us, many of us, have stories to tell. This is something that in one way or another has touched many of our families, but it's all about listening and having conversations, real conversations.
Because it's not like my mom is just physically dependent on me. I am her memory. I am her thinking. I have to be a few steps ahead of her. And as someone suggested, in some ways I think it's difficult caregiving, but there is an end in sight for kids going to school, not so much for your parent that just keeps getting worse. And so you just, as a caregiver, you bang your head against the wall because society doesn't make it easy for us to do our jobs for our loved ones.
The humility that is required to be a caregiver and how someone needs to be okay with doing the dirty work because you want to uphold the person's dignity.
Family caregivers play a critical role as partners in the healthcare ecosystem, but their contributions often come at great personal expense, resulting in serious financial strain.
Sometimes there's a situation where family is comfortable enough that someone can say, okay, I'm going to do this. I'm going to step away from my job. That might be 3 years, 5 years, 10 years, whatever it is, and I can do that. Not everyone can do that, but there's kind of this hidden financial impact that you're not earning, you're not contributing to a pension, a 401k, that kind of thing.
I could be working money and paying for a caregiver, or I could be taking care of my mother, and I choose to take care of my mother. Losing my Social Security, I'm not able to make an income because I'm having to make a choice to take care of my mother versus having someone else or an institution.
I think the financial issue is just, we could not afford to pay for an aide for her. We don't have that liquidity in our income to do that. I could not afford to, if, for example, get a ride share or, have a ride to take her back and forth to where she needs to go during the week. So we just kind of try to work that out between us. But, I still feel that the biggest barrier is her not having a home health aide, because I think in the future she may definitely need one.
Oh, I believe that it was easier for them to receive the help. I know that we call her Niña Angela. Mm-hmm. I know that her condition has deteriorated, so I believe that that's when the doctor saw that the need for her to be taken care of. So it's an official caregiver. Okay. It's just they've been fortunate enough to have a family member be able to be that caregiver. Mm-hmm.
A little bit of assistance would be the personal the pads, or some type of pads that you get. These things are very expensive. I don't know if we could get assistance with her gas. That's another issue.
The demands of caring for a loved one with physical limitations, dementia, or other age-related conditions can take a heavy toll on the caregiver's own health and well-being.
For me, I'm providing individual counseling, and so I've had a number of caregivers that have requested counseling because of anxiety, depression, feeling isolated, having trouble finding resources to get respite care.
Hugely important for the caregivers, because certainly if you can't, if you're not taken care of, then you can't take care of someone else as well as, they would want you to. I think some of the strategies are they do seek out help, and they are seeking respite care.
Many caregivers neglect self-care, and they become overwhelmed with all the responsibilities, and they don't realize how important the self-care is for their functioning. And what I've seen is that a number of caregivers are impacted, not just emotionally, but physically, because they're not taking the opportunity for self-care. They neglect going to the doctor, they don't get enough sleep. And part of this, again, is related to respite care. It's really hard to find quality respite care at a reasonable price.
Caregivers increasingly provide and monitor complex care at home, which requires that they navigate the care system and advocate for their care patient to access the right care and resources.
Our caregivers who are caring for siblings, parents, children, adult children, that is what they just want help. They want someone to go to.
People don't even know to ask for a resource because they don't know something like that could exist. I spoke with a woman who's taking care of her father earlier today and offered some resources, and she said, I've heard something, but I never knew what it was. I couldn't find it on my own.
It's hard to maintain services. It's a little easier to access them, but once you get them, they're harder to maintain. And having sort of a dedicated person who knows you can be really helpful. And I just haven't been able to find that for our seniors.
A lot of them have many different medical needs, very complex medical needs, see many different doctors, specialists throughout the city, and our primary care doctors as well. So definitely communication between the different medical establishments and providers is definitely often challenging. So that can be, really difficult to navigate for patients who, as is in our case, a lot of our patients, English is not their first language, or they don't speak English at all.
Yes, what I took away from listening to the caregivers, I think from the ones today and ones I've worked with in the past, that finding resources to support themselves and their parents has proven difficult. And I think connecting to those resources has also been a challenge. We know that the programs are out there. It's just how do we advertise that? How do we help connect them and facilitate that as well? I think sometimes they get upset, they call numbers, they go on websites, and they just can't connect with a person, and that makes it difficult to connect to the resource.
But you shouldn't have to do that. You shouldn't have to stay on the phone an hour and 15 minutes just to get someone to answer your question.
They hear bits and pieces, or maybe from their friend or things like that, but finding the concrete details and finding the way to sign up has been really difficult for them.
You don't know where to start, and you kind of learn by word of mouth. So luckily I was talking to someone I had graduated high school with, and she had kind of gone through it with one of her coworkers, and she's like, let me get you in touch with him, because he was having to do the same thing with his mom. So I was able to talk to him, and he was kind of able to give me his perspective of what he had to go through and certain places that he had to contact
for them. I've heard again today, and so many times, it's truly, are you finding the right person on the phone? Were you lucky enough to catch the right person on the right day for a specific program or resource to get yourself signed up, or for the caregivers to get the person they're caring for signed up?
Hopefully this will start the conversation and, bring awareness, because I feel like a lot of times our seniors are kind of forgotten about, as well as like the caregivers. I honestly didn't consider myself a caregiver because I'm just taking care of my mom, but it's something.
Yeah. Problems are not insurmountable, but it's just for someone to actually take the time to care and to seek the voices out, to be the representatives of our situation and what it's like for caregivers today.
As stakeholders, we have the responsibility to develop and enact solutions to better support family caregivers and ultimately improve their well-being and the well-being of those for whom they provide care.